aware update on whatever the topic we will be discussing today. And I request all the audience, all the people who are watching us live, do share your queries and questions. We will take up that after Preeti will conclude her talk. Thank you. Over to you, Preeti. Thanks.
Thank you so much, sir. And it is kind of my privilege for as being a part of this platform and being introduced by an eminent personality in Ayurveda like you, whom I have always followed. So the topic for discussion for today is non-communicable diseases, and I'm just start sharing my screen. So is my screen visible to all?
Yes, yes, please proceed. Thank you.
Okay. Yeah, so the topic for discussion for today is decoding NCDs, which is non-communicable diseases, through the lens of Ayurveda. And this is just a very small attempt, and this is just a short disclaimer that whatever data and whatever information I am sharing here is a part of a paper which is in process of publication. Now coming towards the non-communicable diseases, this is kind of word cloud which explains what non-communicable disease is. Here we can see the names of all possible non-communicable diseases which are coined by Western medical system. And just to set the narrative for this talk and to have a better understanding of the context, I am reading out most of the names here, just we can have an understanding. Like the diseases highlighted here are cancer, heart diseases, diabetes, asthma, obesity, hypertension, arthritis, then mental illnesses, stroke, skin diseases also, they are non-communicable, then lupus, spinal diseases, epilepsy, regular allergies, then dementia, renal issues, and skin rashes, and there are a lot of other diseases which comes under the umbrella of non-communicable diseases. Now, why do we need to understand, and why at all do we need to talk about non-communicable diseases? NCDs, they cause almost 70% of deaths worldwide, and they share key modifiable risk factors. Now, what are modifiable risk factors? These are the factors which we can modify by making some kind of changes in our diet, lifestyle, or maybe some disease modifying medications. Modern medicine's approach to manage non-communicable diseases have met only with a limited success. Dietary and lifestyle intervention at present are more about generalized selection. It is not specific to the need of the patient. Inter-individual variability in baseline physiology and connecting the therapy to patient's lifestyle is something which yet remains a goal unachieved. Ayurveda advocates personalized approach wherein method and time of food consumption are equally important as the quality, quantity, and nature of food. Most of the NCDs are multifactorial in origin. They do not have any one pinpoint reason of their being. Therefore, combination of drugs acting on a single target is not likely to be satisfactory. That is where we need an Ayurveda intervention. Since Ayurveda usually follows a wide range of protocols while treating a disease and prefer using multi-components, including diet and lifestyle modification. Now, since these diseases, they do not have a single cause of origin, they are multifactorial. That is why the treatment protocol which is required should also be multifactorial. Now, this image, it explains a lot about NCDs. Number of deaths worldwide from NCDs each year is close to somewhere 36 million, which is a very high number. Then risk factors includes tobacco use, alcohol, physical inactivity, and unhealthy diet. Now, let's focus on unhealthy diet, that what exactly comes under unhealthy diet. Now, if we consider the Ayurveda principles, unhealthy diet is not only the one with poor nutrition value, but it is also the one which is consumed without considering inter-individual variabilities pertaining to physiological factors, which is the most important physiological factor in Ayurveda is Agni. Since the quantity of food depends upon metabolism, which is very much specific, And it is advised to follow personalized approach as per the Ahar Matra, which is Agni Bal. And Ayurveda focuses on functional aspect of food and activities for attaining a balanced dosha. It accentuates a thoughtful use of food and activities, and also highlights the how much, when, and what factor, rather than just focusing on intake and burnout of calories and macro and micronutrients intake. It also asserts on methods of consumption of food, activities, and thoughts as an aspect of lifestyle planning, not just a meal planning or an exercise planning. Now, if we talk a bit more about Agni, when functioning properly, Agni plays an important role in conversion of complex insoluble molecules into simple soluble molecules for assimilation. When it becomes abnormal, it is the reason for indigestion, thereby an impaired metabolism. And improper functioning of Agni leads to various metabolic disturbances. In Ayurveda, nearly all the diseases have their origin in Am dosh. Now, what is Am? Am is nothing but a metabolic toxin, which is defined as a condition in which the Rasadhatu is not formed properly due to, again, impaired Agni. And in this state, whatever food is ingested, it becomes dusht, which is also known as either Am dosh or Am vish, which leads to metabolic diseases. Now, the concept of Agni is physiological, but Am is a pathological entity. Normalcy of all the mechanisms of the body is totally dependent upon normal functioning of Agni. And when Agni gets disturbed due to any etiological factor for that matter, it initiates pathological events, which is a group of pathological events. Eventually, it leads to disease conditions. And non-communicable diseases includes a wide range of disease conditions, which are primarily metabolic in origin. Now, Ayurveda advocates specific rules for taking diet, such as Ashtahar Vidhi Vishesh Ayatan, which includes Prakriti, Karan, Sanyog, Rashi, Desh, Kal, Upyog, Sanstha, and Upyogta. Then we have Ahar Vidhi Vidhan, which is Ushnam Ashniyat, Snigdham Ashniyat, Matravat Ahar, Jirne Ashniyat, etc. Then we have Dwadash Pravicharna, which is various kind of food combinations. And then there are also specific regimen for regulation of lifestyle, such as Dincharya, Ritucharya, even Ratricharya. Then Sadvrit, Vegdharan and Adharan is also a very important concept. And then comes Garbhini Paricharya and Garbha Sanskar, which actually affects the epigenetic fingerprint of our diseases. Ahar and Vihar, they are the key modalities of prevention and management of diseases in Ayurveda. And the interventions are targeted more towards complete physical, mental, even psychological and spiritual well-being. Thereby, Ayurveda follows a system biology approach rather than the reductionistic approach of the modern biology or the Western system of medicine. And Ayurveda clearly defines that every pathological manifestation has two kinds of origin, rather three origins, which could be the Nidan, could be either Aharaj, Viharaj, or even Kalaj. Even the seasonal fluctuation matters. Therefore, there are external factors of dosh and dosha perturbation, which are as important as the internal factors. Thereby, we can understand the importance of all these regimen-related factors like Dincharya, Ritucharya, Ratricharya, etc. Now, here I have tried to kind of enlist basic mistakes that we generally do with our daily practices. Number one being Ajirnashan, that is, we consume food during indigestion. You know, the kind of lifestyle that all of us and our patients are having right now is more regulated to the time. We have lunch break between 1 and 2, so we don't really consider the hunger aspect, and we just see the time that yes, abhi lunch ka time hai, so we have to eat our lunch rather, and we do not give attention of whether we are hungry at that time or not. Then comes Vishamashan, which is consuming either less food or more quantity of food, and that too at an improper time. Then Adhyashan is again consuming food when previously taken food is not digested. Viruddhashan, consuming incompatible food which contains a wide range of modern nutrition products. Then comes Vegdharan, which is the suppression of natural urges. Now, this is something I've tried to kind of decode all the Ashan practices. And these here you can see the dietary practices on the left side of the screen, which are Upvas, Pramitashan, Anashan, Alpashan, Laghuashan, Aptarpan, Langhan, Vishamashan, Ajirnashan, Viruddhahar, and Adhyashan. And on the other side, there are the effect of disease pathophysiology. These are just a few examples. So here you can easily see that some of the practices like Upavas and Laghuashan, Aptarpan, even Langhan, these are all the cause of diseases, as well as these are used in management of diseases. So here we can see the importance of Ashan, which is how we are eating, what we are eating, and how much we are eating. Then here is the concept of Vegdharan, how it affects our systems. Considering the entire system biology approach, here I have tried to enlist 5 systems and the Vegas which affect these systems pathologically. And these are the some clinical features, or we can say some signs and symptoms, or even some syndromes if they get combined. And then there are the Vegas jinke dharan se we can see these kind of symptoms in our patients. Now this image, this graph represents the number of diseases with dietary pattern as an etiology, and we can see that maximum number of diseases are caused by ajirnashan. Then there is vishamashan, then pramitashan, that is eating less than required. Then we have viruddhashan, and others also follow. This slide represents the number of diseases with dietary pattern as a treatment. So Upavas and Langhan, they are used in treatment of various diseases. So these are not just the dietary aspects of the food, these are also part of treatment. So whenever we decide to go for long fasting or any kind of Western approach towards weight management or disease management, we should consider these aspects as well. Here you can see the image which is trying to explain the inflammation, the metabolic programming, and the immune programming of our system, which explains the correlation between your gut and the microbiome, and it explains how the risk of metabolic dysregulation generates. Now, the crosstalk between the host, diet, and gut microbiota play a major part in developing a better understanding towards how disease develops. Agni signifies the metabolism process as a whole. Every host, as per Ayurveda, has different Agni depending upon various factors like Prakriti, Vikriti, and the environment one is exposed to. Now, this environment could be the season, the time of the day, and the psychological environment, emotional environment. Everything comes under the host environment, the external environment. The external environment, it contains ahar as well as vihar along with seasonal manifestations. And this multitude of variables can have positive or negative outcomes on the gut microbiota. It is a well-established fact that every individual has different gut microbiome, and it is the gut microbiome is directly related to your immunity, which is your host self-defense mechanism. If we view this concept of gut microbiota through the lens of Ayurveda, we can infer that perturbation of the doshas according to external environment, food environment, or even the lifestyle, along with the baseline prakriti, plays a very important part in regularizing or development of the gut microbiome and the process of inflammation at large. And therefore, prakriti types are also presented with different immunity levels. Now we have seen in our samhitas also that Vata prakriti individuals, they have the least immunity and they are most prone to diseases. And we can try to understand this concept with our non-communicable diseases part as well. And then we also experience a seasonal shift in immunity, which can be explained by the concept of dosh vriddhi and kshay during Uttarayan and again during the Dakshinayan. Now, Uttarayan is the summer solstice, where the movement of sun is from south to north, and Dakshinayan is the winter solstice, where the movement of sun is from north to the south. These external factors affect the internal axis of the doshas as well. Now, when we have the internal body environment, the Prakriti is more towards Vata Pitta, and the external environment is also something which is aggravating Vata and Pitta, and then we have diet and lifestyle also which is aggravating the same doshas, then you can imagine the magnitude of the disease which the patient can have. And when these doshas are perturbated, the Agni is perturbed, thereby completely disturbing the gut microbiome, and hence the entire immunity, the host self-defense mechanism is completely disturbed, and thereby it leads to various metabolic diseases, metabolic dysregulation, and hence the non-communicable diseases. Now, simplifying all what I have said before, Agni, it is impaired by faulty lifestyle practices, not just the diet alone. Now, diet in Ayurveda is far more than what we call as the macronutrient, micronutrients, or the combination of protein, energy, fats, and vitamins. It is much more than that. We have shadras, then we have various forms of how to consume the meal, which ras we have to take first, and all those factors play a very important role. Then there happens metabolic dysregulation once Agni is impaired. Metabolic dysregulation leads to impaired patency of our strotas, thereby leading to srotorod or srotosang and impaired immunity. Now, whenever there is either srotorod or srotosang, there are inflammatory changes. The shodh happens and the inflammation is generated, which again leads to even bad immunity. And then disease pathogenesis happens, and then the disease completely develops. Now, here I have tried to kind of simplify. Now, you can see that there is a stratification of population in Vata, Pitta, and Kapha, although there are other permutation and combinations. But due to a restriction in the space and for ease of explanation, I have just given 3 major stratifications of a population. Now you can see on the left, if the entire population goes for a generalized practice, like one size fits all, it will lead to chronic diseases and a lot of health issues. And then if the same population goes for personalized practices, it will lead to health, wellness, vitality, and a more absorption of the nutrients and a better lifestyle, a better health. So this is how I have tried to summarize the entire talk. And Ayurveda has laid down guidelines for integration of a personalized approach in determining a suitable dietary practice, considering the desh, kal, prakriti of an individual. Along with deciding on number of meals to be consumed with their amount, there is a focus on food items as well, their relative proportions, dosh specificity, combinations, and food forms, etc. Ayurveda approach can not only improve the present health status of an individual, but it can also help in lowering down the global disease burden by acting as an important tool to avoid manifestation of diseases with modifiable etiological factors, like the factors that we just discussed in previous slides. They are all modifiable. There is nothing we cannot modify. And hence this one-liner that the science, that is Ayurveda, is a wonderful option in non-communicable diseases or lifestyle disease management. So now, and thanks a lot for your patience and your time. And if anyone wishes to connect, I'm available on these number and the email ID. Thank you. And if there are any queries, please, we can take the queries.
Thank you, Dr. Preeti, for your this wonderful session, and we hope that we will continue forward with you, and hopefully the audience enjoyed a lot, as we can see in the comment section. People enjoyed it. Thank you so much.
Thank you.
Yeah, thank you so much for giving your precious time, and we hope to see you again with Namabangi Trust.
Sure.
Yeah,
Thanks.
thank you so much, ma'am.
Thanks.